I often talk about everybody else will say, what can I do when I give talks to groups, not patients, but to communities?
Yeah.
What can I do? I don't have sickle disease. Nobody in my family has sickle disease, but the village, the concept of the village is so important for this condition because it affects African Americans mostly in our country. Many African Americans are already disadvantaged socioeconomically, and so to have a neighbor or friend or church member, somebody that you already are part of a family with, to have that person not have to ask you, what can I do to help you? Because the parent, the patients, they're not gonna they're not gonna be able to think of anything right this minute.
Right.
But overall, if you just think about if you were in this position, my child is sick in the hospital, I have my other children at home, who's seeing about them, who's picking them up from school. We don't have any groceries in the house because I'm in the hospital with a sick child. Somebody needs to get groceries. One child needs to go to the ball practice or whatever because you're trying to maintain the lives of your other children and other family members, and you're trying to take care of your sick child. And so it's offering, I can pick your children up, instead of waiting for the patient to say, I need you to do A, B, C, D, and E. You can just look around and say, I can pick your kid. Who's picking your kids up? Or have you all been to you got clothes that need to go to the laundromat? Just things that are simple. Transportation, a big problem. Many times, if you have to ride the bus to get to your clinic appointment, the bus runs during the day, but then at night, child has a fever 102 at 11 o'clock at night. And Dr. Jackson said, I'm supposed to go to the ER at 11 o'clock at night as soon as the fever manifests. I don't have how are we going to get there? ER. And this is when the community understands the disease and the urgencies associated with the disease, then it supports the patient, it supports the family, it makes the livelihood of that sick child with the fever 102, he might die from sepsis if we don't act quickly. But if nobody in the community knows that, they don't know because everybody else has fever 102 and they're not dying.
Right.
Give them Tylenol and sponge them off and settle them down. But with this disease, that's exactly wrong. We have to act on it. And so it's that support from a community that's so important. I just recall a family that everything I'm telling you now is what the mothers had to deal with. The child had a fever in clinic. They came on the bus to the clinic appointment. Child wasn't even sick, but sure enough had fever. Couldn't go back home, had to get admitted. Well, the other kids hadn't gotten home from school, and there was nobody to be home with them when they got off the bus. And then she had to be in the hospital to get the child admitted, a toddler. And the toddler's terrified if the mom is not there 24 hours. But she had to leave to go back home, take the well child that she had with her, take that one back home on the bus, and then gather up clothes and gather up a frozen dinner so she would have something to eat when she got back to the hospital. And it just, just the fact that they didn't have a ride home, she had to wait for the bus to get back home. It just broke my heart that the system is like it is. But this is when our neighbors and friends and church friends and everybody says, oh, I'll do I'll help you out. I'll do what you need. But if you don't really know it's the disease causing this cluster of circumstances, It's not, and sometimes people will judge the parent and say, well, why didn't she make a better plan for all of this? But it's the fever being there. That's a medical problem that we medical people have decided how it should be managed. And then the patient and family have to try to fit into that model because we're going to fuss at you if you don't bring your child in when they have fever.
Yeah.
And they're going to say, don't they know that this is life potentially life threatening? Yes, they do, but all the 10 other things that had to fit into place in order to get that sick child in to be seen. But that's the thing. It takes a village. We all need to be aware and be informed of how this condition, especially in childhood, can be uh, demanding on everybody's time, everybody's attention.